Hello everyone, I'm Dr. Neha Chauhan, consultant plastic, aesthetic and reconstructive surgeon with Aster Hospital, Whitefield. Today I'll be going to speak about a very interesting topic called as breast augmentation. Breasts are not only the source of feeding for the newborns, but also are a symbol of feminine beauty. So if they are larger in size or smaller in size, women usually suffer from different kinds of problems. Breast augmentation is a procedure which is done to enhance the size of breast. It is commonly done in patients who are having very small sized breasts which are disproportionate to their body, or in patients who have asymmetry, major asymmetries between the breast, or patients who suffer from absence of breast, like in patients who have Poland's syndrome. The ideal candidates for breast augmentation are those who are self-motivated, like they themselves have been researching about the topic a lot and they have never been happy with their breast size. Whenever it is done because of their own motivation, the patients are usually very happy after it. The procedure should not be done at the behest of somebody else or under some kind of pressure. Now I'll be talking to you about how the procedure is done. The procedure can be done by either using implants, which is the most commonly used modality, or using patient's own fat. In some patients, we can use a combination of both implants and fat. When we use implants, the most commonly used implants would be the silicone implants. The common myths which surround breast augmentation surgery are that implants may be looking unnatural or they may feel different than the regular breast tissue. This is not so. The breast implants have been designed after a lot of research and they feel exactly like the breast tissue should feel. The second common myth associated with breast implant is that breast implants can induce cancer. This is not correct. Every one woman in 8 can develop a breast cancer even without having implants. So the ratio of women who can develop breast cancer with implants remains the same. However, there is a cancer which is called as breast implant associated anaplastic large cell lymphoma, which has been noticed in few patients out of the multiple patients that we operate. The incidence has been only 1,130 patients amongst all the patients who have been operated across the globe till now. Another myth which surrounds breast implant surgery is that breast implants can rupture with day-to-day activities. I wish to state that the breast implants do not rupture and they are good to go with the regular activities of an individual. Breast implant is usually a daycare procedure which requires around 2 to 3 hours of surgery time, and it is done using a small incision which lies in the inframammary crease. That is the most common site of incision that we use in our practice. The implant can be placed either under the gland or under the fascia or under the muscle or in a dual plane. The recovery is usually very quick. Patient can be back to work in next 2 to 3 days and they can be back to their regular exercises after 6 to 8 weeks. In case the small size of your breast has been bothering you and you have been considering breast augmentation for quite some time, I would advise you to come to us at Aster and schedule a consultation with our plastic surgery team to take the journey forward.